Hey class, I just wanted to talk through the kind of dysfunctions that we see in posture. So just kind of going through, and the first one's going to be the kyphotic lordotic posture. Really, with the kyphotic lordotic posture, we see kind of the zigzag type posture, and this is a way that kind of some people can explain kind of this zigzag posture, where really we see this really kind of over exaggeration of the um, um, kyphotic curve, or kind of seeing that kyphosis, and then also that lordotic curve. So we're almost seeing kind of over curvature of the lumbar spine. So with this, really what is being kind of weak is kind of, or what is weak is the abdominals, the multifidi, kind of through the kind of the kind of support for the vertebrae. Also, the hamstrings are pretty weak during that. But really, what we see are the hip flexors being a little bit more tight, and so we see the pelvis kind of tilting forward, and then also really kind of seeing kind of tight through the pecs, and really kind of tight through the anterior shoulders, and really trying to help and assist kind of open this up. So really, we see kind of this enlargement of the spinal curves due to these different weaknesses. Okay. Also lordosis, and really what I'm kind of saying here is hyperlordosis. So seeing that exaggeration of the kind of lordotic curve, and seeing kind of a hyperextension kind of at the pelvis. So really with that, yeah, seeing that kind of hyperextension. Really, this is going to be in that main kind of, could be congenital. We could definitely see kind of spinal deformities. We can see weakness of the abdominal muscles, really poor postural habits as well. So sometimes even just sitting a lot can cause the hyperlordosis. I would say even like, doing a lot of back squats, other things like that, it kind of pushes you into that hyper extension kind of at the pelvis. Now, definitely with that, usually we have some ways to kind of counteract that, but you can see that sometimes with that. You also will see kind of some counter movements associated with that. So really with that, sometimes you'll see the head extended, other things kind of impacting kind of the stemming from kind of that hyperlordosis that we're seeing. Okay, so lordosis itself, like even in a normal spine, we're going to have lordosis. We have that lordotic curve, but really what we're talking about in this example is that hyperlordosis, that over exaggeration of the lordotic curve. Okay. And then kyphosis. We kind of talked about that in that initial one, but the kyphosis specifically is really, some people will call it round back. I don't really like calling it round back, but some people will call it that. But what we'll see with kyphosis is really kind of a compensation with the neck, right? We'll see that kind of extending. You can kind of see that in that picture here of seeing kind of that neck being tilted forward and kind of hyperextending a little bit. But really, this is caused from kind of these thoracic extensors, so the rhomboids. Really, kind of you see those weaken, but you see once again kind of pectorals being tight and then pulling forward. And so, with that, really trying to work on the upper back, really working on the traps, working on the rhomboids to help and assist with that scapular retraction, and really trying to be more upright. Okay. Definitely some of the causes in degenerative diseases, we could really have developmental problems where we see kind of these wedge shapes that, wedge shape kind of epiphyseal plate abnormalities kind of during birth and through development, where we could see kind of these wedge shape or triangle shaped vertebrae that's really going to cause kind of this hyper kyphosis. And then really osteoporosis, we can see compression fractures. We can see kind of the vertebrae kind of break down. And with that, we could cause kyphosis as well. Okay. In a very serious case, we can see the Sherman's disease. I would highly recommend kind of Googling it and looking it up. It is very dramatic. Really, we see kind of that almost like a point with that the kyphosis. Now, definitely with that, you could really have some health issues associated with that. So definitely seeing more kind of issues in regards to pulmonary function, definitely in circulation. We kind of talked about this in class a little bit too, where you could see maybe a little bit more. Even digestion issues associated with that, because it's all compressed kind of in that kind of right in that thoracic region. Um, We'd all see scoliosis, so definitely within that, definitely seeing that lateral curvature of the spine. Okay, so really within that, you're going to see compensations as well. You can see the head kind of tilted to the side. You can see hips kind of come upright a little bit more, so we're looking kind of straight ahead. But really, could be congenital. Definitely we can see that kind of repetitive type motion. So carrying heavy objects or through kind of specific movements that you're doing throughout the day, we could see issues in regards to scoliosis coming about. We could see leg length discrepancies. And in some cases, we really just don't know what's causing the scoliosis. Now, sometimes that could be tightness of the muscles or ligaments that could be causing this, but in some cases, it's really kind of undiagnosed. We don't know that for sure. Another one is flat back, and really flat back is essentially the absence of that lordotic curve. And so really kind of through the lumbar spine, we're not seeing that lordotic curve. Now, we talked about that a little bit in class where sitting down, you can have that flat back, so it's so important to have kind of some lumbar support. But really with the flat back, this is kind of continual kind of motion. Really what we're seeing is weakness. So definitely you could see kind of hamstrings being short and tight, where the hamstrings are kind of pulling the pelvis backwards. So we see this kind of posterior rotation of the pelvis, which is really causes the absence of that lordotic curve. And then once again, kind of the hip flexors are just not doing their job. And so I think one of the big things with flat back is really kind of developing the hip flexors, really working on kind of the abs and really helping to assist with the abs to help and kind of counteract the tight hamstrings that we have. Also really working on flexibility in the hamstrings, right, to help and assist with not having them so tight and pulling that pelvis, rotating it backwards. The last one I want to talk through is kind of torticollis. Torticollis could be tightness of that sternocleidomastoid. Really, we see kind of this abnormal shift in the head, and then really with that, we're going to have some compensation. If I'm kind of shifted to the side, I'm going to have some compensations that are going to impact, and really we could see kind of scoliosis from torticollis. Now, sometimes the scoliosis is only coming from the compensation that I am providing, so I can look straight ahead. So it's not always just the case that you're going to have scoliosis if you have torticollis, but you're going to see compensations associated with this. But really what's happening is that kind of the compromised sternocleidomastoid, that muscle kind of right to the side, helping with rotation, helping with flexion, extension. But really with that, you can see it kind of shift to the side, and we're going to see compensations throughout the back. Okay. Other kind of common postural distortions that we can see, kind of forward head posture, we can see that kind of protruding out, as you can kind of see kind of in both these pictures here. Rounded shoulders, definitely we see that a lot. That's going to lead to a little bit more kyphosis. Raised shoulders, definitely that could lead to kind of lateral curvature in the spine. Hyperpronation as well, so hypopronation of the feet could lead definitely to impacts definitely on the knees, and definitely we could also see kind of impacts kind of in the hips, right? And then that can lead to some of these kind of postural distortions that we can see, or compensations kind of throughout that kinetic chain. Definitely there's some examples that we could possibly see kind of throughout sports. We've talked about before kind of commonalities we can possibly see through sports, we can see through kind of specific actions that we kind of do, chronic actions that we see, or repetitive actions that we see. But commonalities that we can kind of see in sports and athletes. These are just some examples that we could possibly see. Definitely with cycling, you're going to see kind of that kyphotic type motion, trying to be more aerodynamic. Definitely with swinging rotational type sports, you can kind of see kind of imbalances throughout the back, and definitely from arm to arm or leg to leg. Power lifters as well, like I said, kind of hyperlordosis, especially if we're doing a lot of back squats, if we're not kind of compensating, or at least kind of accounting for that with our other resistance type training, we could possibly see kind of hyperlordosis. Definitely runners, we could kind of see imbalances to kind of quadricep and hamstring strength. Now definitely, like we just said in regards to flat back, we could possibly see some impacts on that as well. And then other postural distortions we could possibly see, or what could lead to kind of just some issues associated with that. So really when we're talking about postural distortions, kind of primary distortion, we could see kind of a problem that occurs at that specific area. So once again, if we have like a vertebrae that's like hypomobile, it's not moving very much, that's that primary distortion. Maybe the secondary distortion is kind of that problem that's caused by that primary distortion, right? So if we had that hypomobility or that hypo mobile type vertebrae, we're going to have maybe hypermobile vertebrae on each side of that, right? So that's kind of that primary distortion is leading to that secondary distortion, where the distortion pattern is kind of combination of primary and secondary variances, where we could see kind of impacts throughout the spine, where we start to see pain, where we start to see imbalances kind of in muscles or pain in the muscles, or once again, impacts on the ligaments. That's kind of that distortional pattern where once again, that's not necessarily going away. And all of a sudden we're seeing a pattern build up based off this primary and secondary distortion. Okay. And then definitely just overall compensations that we'll see. So definitely counterbalance. We shift a part of our body, similar to what I talked about with that torticollis. If I'm kind of shifted to one side, I'm going to shift the rest of my body, right? So that I can actually see that. So shifting a part of your body in the opposite direction of another. Or let's say if I'm kyphotic and I'm sticking my head out a little bit or extending it back, that would be that counterbalance. Also, like we talked about with that hypomobility or a hypermobility, that's where we're going to see some impacts, right? So the hypomobility versus hypermobility, you could see kind of compensations occurring due to maybe a fixed kind of vertebrae where we're seeing the hypermobile on the other side. Okay. We could also see impacts on the agonist and antagonist relationship in the muscle. Okay. So we could see actually kind of muscle tone change, and then really kind of the overall gaining mechanical advantage could be impacted due to kind of the alignment being impacted. So let's say the vertebrae is out a little bit. The main agonist could be impacted. That's impacting the overall antagonist and the support associated with that. Could actually compound and make that situation worse. Okay. Also, one of the things that we can see is kind of postural sway. Really, with posture, we talked about that being dynamic. It's always changing. One of the reasons why is that postural sway, where we see that center of gravity kind of continually displacing. We're kind of returning back to that center of gravity. We just see that moving kind of quite a bit. Now, definitely maybe not as dramatic as this little GIF that's here, but at the same time, we could see some impacts for sure in regards to postural sway, and we're always seeing, once again, changes in that posture. One of the big things and kind of promotes, it helps to promote venous return. So that movement that we have helps with that muscle pump and helps with activating some of these specific muscles. So postural sway, one is kind of just adjustment to gravity, balance overall, trying to keep our equilibrium, but also it helps to assist with kind of that venous return and help with, once again, activating these muscles to help with bringing circulation up to the heart. Okay. One thing that just overall, a question that I would probably ask in the class is, which position do you think is the worst in regards to the back and more stress on the back? So there was a study that was done that was looking at kind of the percent of load compression on L3, so very specific, but L3, so lumbar spine, L3 during the upright standing, lying down, or sitting. Which one do you think is worse? Now, it's definitely giving it away here in the overall worst. I thought actually standing and kind of flex forward would be the worst due to, I don't know, I thought sitting would maybe be a little bit more support. I was wrong. So compression increases more with spinal flexion and increases still further with a slouch sitting position. Now that definitely can make sense to what we talked about before. When we're sit down on a chair, we have kind of that posterior rotation of the hips. Now, if we flex forward, we're kind of getting rid of that and we're kind of going into that flat back. And then if we flex forward, that's even more stress on that lumbar spine, right? So the percent load, like I said, is even worse when we are slouched sitting. So definitely sitting on the laptop, sitting like I'm doing right now, definitely is a lot of load on L3 and a lot of force kind of on that anterior aspect of the intervertebral disc that could definitely cause some issues over time. Okay. So that is the key things I want to go through in regards to posture and to kind of finish that posture talk. I have released the posture quiz, so definitely please kind of through this kind of next week is kind of finish that posture quiz. You have kind of two different, you have 2 weeks to do this, but at the same time, I think definitely during this time without classes, I'd recommend doing that. So I hope all of you are doing well, and definitely I will talk soon. All right, bye.